Eyewitness News Health Beat.
And on the Health Beat tonight, some groundbreaking news on a drug that fights Parkinson's disease. Health Beat reporter Marie Tiernan joins us now with details and some very good news here.
It's very exciting news, Andrea. And you know, many of you have been watching this past weekend, and even today we showed you images of the Pope. You see his tremors from Parkinson's. It's the very same thing for Michael J. Fox. And at issue with these patients, muscle control. The muscles get stiff and slow. Now, typically these patients take pills, but now there's a new injectable dose that's getting patients relief much faster.
Well, I was 44 when I was first diagnosed.
Now 51 with Parkinson's, Geist resident Wayne Stone struggles with hypomobility or off episodes, where a trip to the mailbox is out of the question.
I have peaks and valleys, if you will, in my dexterity.
To level out those periods, Stone 3 to 4 times a day injects himself with Apokyn.
Let's just put it this way, there is no alternate for this drug at the present time.
Southside neurologist Farouk Khan sees significant improvement in Stone and other patients in just 20 minutes after an injection during an off period. Take a look at this standard motor skills test. This is before tapping fingers.
You'll notice how he tends to be very slow.
Or this rotation.
You can really easily see here the asymmetry, where the right hand is clearly slower and has less excursion than the left, but both are clearly abnormal.
And finally, getting up, a slow process during an off period.
And let's see if you can walk here in the office.
Are you close?
The steps small, almost shuffles. The injection from a group of drugs called dopamine agonists is similar to an insulin or allergy shot. In about 20 minutes, the motor skills change is remarkable. See the fingers tap faster.
Good.
The rotations here, bigger and faster.
Rotate him through a circle.
And getting up to walk, bigger steps, a fluid motion. For Stone and other Parkinson's patients, it means more functional time.
It means I have an hour, 1 to 3 hours more quality time, which is fantastic.
A side effect for Stone is yawning. Other patients may experience nausea, vomiting, and lightheadedness. Now, before taking this drug, Stone said it took about an hour to an hour and a half for his medication to work. Now, keep in mind, this therapy works best as an adjunct with other Parkinson's medications.
What a great progress there. Mrs. Stone looked fabulous.
Absolutely.
All right, Emery, thanks so much. Scott?
Coming up next, and all new here at 5:30 with stormy weather ahead. Go around your house with Tree Boy tonight. You'll find out what you need to do for spring fix-ups. Plus,
He's a little chocolate.
And Demore has been on that story, and a lot of people hoping this sheds some light on things.
Well, they're hoping this is a cure, but right now, Ann, it's just really too soon to tell, but researchers say it sure is promising. A 55-year-old New York man is the first patient to undergo gene therapy for Parkinson's, but doctors won't know how effective it is for another few months. Trials are underway to determine if the treatment is safe. Tonight, reaction from a local doctor and a woman who suffers from the disease.
Good. Keep those shoulders back and up. Sit up nice and tall. Raise up. Pull back.
This physical therapy class is for people with Parkinson's disease and their spouses. Hilda Miller was diagnosed with the disease in 1995.
I didn't really know what was wrong. I knew something was wrong because I had problems with movement. I got rigid. I had problems with slowness.
These exercises work on strengthening, flexibility, and range of motion.
We work a lot on posture. We work a lot on loosening up the trunk here, because with Parkinson's disease, people tend to really get rigid through the trunk.
A promising new treatment is on the horizon for patients like Hilda. Doctors in New York are conducting clinical trials on gene therapy to treat Parkinson's. This 55-year-old man who got the treatment earlier this week is now recovering and doing well. Gene therapy could work by slowing down areas of the brain that Parkinson's speeds up. Dr. Farouk Khan, a neurologist with St. Francis and St. Vincent hospitals, says the disease kills off brain cells.
So these cells die out one by one, and as they die out, you have less dopamine than what the body requires. Without dopamine, you get the cardinal features of Parkinson's disease.
With Parkinson's, I have this little saying that, you know, the body can't, because you've lost the connection between, you know, I think I want to do this and being able to do it.
Hilda's accepted her disease, and while she's skeptical about gene therapy, she isn't holding out hope.
Hopefully someday there'll be a cure, but I think you just have to resign yourself that, you know, you have this problem and you have to think positively about it and do the best you can and keep on moving.
Dr. Khan cautions gene therapy is experimental and more studies are needed to determine its safety and effectiveness. Well, the FDA just approved a new test that can actually help predict heart attacks.